Okay, there we go. All right, so here we have it. Let me just get this thing recording for everybody else. Sorry, it's quite a challenge to actually do a million things at once. Megs, I'm not sure if you can see it. It is marked as recording on my side, so I'm sure we should be fine. Okay, all right, so a little bit of an introduction. I'm going to go through it literally as though I was speaking to someone who didn't have an idea about rare diseases at all, because I know that some of you have never really had the opportunity to hear us speak or present anywhere. So I'm going to start relatively from the beginning. So our vision at Rare Diseases South Africa is a South Africa where those impacted by rare diseases access life-saving treatment and supportive care for improved quality of life. So that's an important thing, obviously, to take note of, because it's not only necessarily about accessing a commercial treatment, as in tablets or a syrup or a treatment as such, but also supportive care, because we know that many of our patients will never have the opportunity to actually have a treatment. So supportive care is equally as important, and that involves things such as therapy, palliative care, pain control, etc. Our mission is to strengthen the voice of those impacted by rare disease and improve quality of life by bridging the gap through industry advocacy and patient empowerment. And our global alignment are consistent with that of the health-related sustainable development goals as specified by the United Nations, as well as the premise of universal healthcare. So I know many of you might know universal healthcare from all the NHI documents. And our values are care, dignity, equality, and empowerment. Before I carry on, I just want to say at any point, you're more than welcome to raise your hand or ask questions if there's something that you need urgent clarity on. Otherwise, I will regularly stop and take questions. So our focus areas, we were initially rare diseases focused on care and support. And that really stemmed from my personal need on starting the organization, whereby I felt that that was what I needed the most, was access to coping skills, general wellness, guidance, family counseling, understanding how to navigate our future. And from a community support perspective, it was connecting with other families and patients, knowing which doctors were doing what, in what field, you know, medical partners, which foundations were working in the area. And that's really been the space that Rare Diseases has spent the first 5 years in. As time has now gone by, we find ourselves moving over to the right-hand side of the circle, which involves expertise and advice. And it's been a bit of a difficult transition for us because with moving from care and support over to expertise and advice, I was kind of grappling with how we would do that, how we would take the next step into really becoming strong advocates and focusing on the governmental work, etc., that is required without leaving our patients as individuals behind. And this is exactly the sort of area where this sorts of programs comes in. So with regards to medical advancement, it's things like developing new innovation, access to clinical trials, new methods, new treatments, etc., as well as education from a best practices perspective, assisting doctors in terms of improved knowledge, helping patients access the appropriate resources and facilities, etc. So really it has been quite a difficult changeover for us as an organization. So the context and rationale, why do we exist? We know that only 5% of rare diseases have an FDA-approved drug, which leaves 95% of our patients without any access to therapy. So if you're one of those groups that land up in that scenario where there's literally nothing, you don't want to hear from a doctor, sorry, there's nothing we can do for you. You'd like to know that someone's out there really still trying to improve your quality of life. There's more than 350 million people affected globally, and we estimate about 3.7 million South Africans. and over 7,000 different conditions. So it is quite a large space, obviously lots of work going on. If you look at us from a South African perspective, if you zone in on South Africa, we've actually only accessed less than 1% of the entire rare disease community. And despite the fact that we've had over 1,000% growth in 5 years, I mean, realistically speaking, we still have so much work to do that it's actually quite scary. So quality of life for people with rare diseases is not dependent on severity of illness, but rather on the availability of treatment, health systems, broader social support, and access to supportive care. So the challenges from a patient perspective have been things like lack of knowledge in terms of healthcare professionals. You know, the doctors that we sometimes land up in front of don't necessarily have the necessary knowledge. Sorry, someone is, oh thanks, I don't know who's muted them. Lack of awareness, access to accurate information and resources, isolation and stigma, long wait for diagnosis, access to treatments and reimbursement, depression and anxiety, limited work education, and the financial burdens. So having taken all of that into account, it was really quite a difficult sort of thing to make sure that we had kind of put a system in place to kind of alleviate all of those areas. And that's really when we were doing the care and support, and that was the primary focus, the stuff that we've actually put into play. So in terms of knowledge, we've obviously got our biannual conference, we've got webinar series. In terms of lack of awareness, we do things like Rare Disease Day, media. In terms of accurate info and resources, we've set up the Resource Hub. In terms of isolation and stigma, it has been creating the online community platforms and the networking events. In terms of the long wait for diagnosis, it's been referrals for genetic services. In terms of access to treatment and reimbursement, we have our Rare Assist program. Depression and anxiety, we've developed partnerships and programs with other organizations who are better placed than us to assist patients in that scenario. Limited work and education, we've provided policy input to the education policies as well as disability in the workplace, etc. And financial burden, we've provided fundraising support. So we have really worked hard in the first couple of years to make sure that we've tried to do something. It hasn't, I mean, we're by no means 100% of the way there, but to try to do something along the way. So if we look at a situational analysis from a big picture, so not necessarily now focusing on patients as individuals, but looking at rare diseases across the country, what are the challenges we have? We've got a dual healthcare system, which is the private and the public sector. We have lack of knowledge and awareness. We have lack of data. We have no local definition. We have no orphan drug policy. And this has all resulted in limited access to treatment. So rare diseases has now had to pull on their big girl panties, so to speak, and really focus on what we're going to do now to address the macro scenario and how we're going to address these issues. And it's a really, really daunting task. And, you know, I'm a little bit scared, but we've got a plan in place. So the plan is this little theory of change document. And essentially it starts off with fundraising, and it's not fundraising in the standard sense that you guys might be thinking. It's really income generation to be able to support these programs. From there, it will move on to data collection. We have started working on some thoughts really around appropriate data collection, how we can do it to make sure it slots into bigger picture. Problem assessment, we have done that. We did a lot of this work with regards to the Presidential Health Compact. Landscape mapping and policy assessment as well, that has taken place. That's a continuous thing. And obviously developing partnerships and alliances, because we've realized we can't do it alone. And with those, it then splits into partnerships and alliances, as in us working alongside other big healthcare organizations that are not necessarily rare disease focused, as well as coalition network and building, and that's the likes of this group. And from there, you split into policymaker education. So the partnerships and alliances are, if you think of TAC and Section 27, etc., they are really focused in the government sector. The public awareness comes from the yous and me's of the world, all of you guys on this call, in terms of making the generalized public aware. So we've got to focus on it from a two-tiered perspective. And hopefully with that, we will have developed changed political will, as well as changed the public will. And from there, hopefully we'll rely on policy adoption and policy implementation. So before I carry on any further, I'm going to come back and see if anybody has any questions. If you do have questions, would you please just raise your hand or just unmute yourself and ask? Okay. So we're good. No questions at this point. That's fantastic. Okay, so moving on. If we look at, you will see a lot of our documentation now refers to bridging the gap. And bridging the gap really has three functions. There's the emotional sense, and that is actually being the place or the connection or the transition. So it's building the bridge between suffering and healing, and from despair to care, or from feeling hopeless to being hopeful. So that is very much our community engagement. Then we've got the functional section, which is a structure carrying a pathway or roadway, and that's really our patient navigation. So it's taking a patient who's stuck in point A and assisting them to get to point B, C, D, E, F, and as the journey goes. And then we've got the rational sense, which is a gap to connect two things. And that's our advocacy space. It's making the difference between what we would like to have and what we currently have now smaller. So what is the Rare Voices program? So before I carry on, I just want to give you guys some context. So at the moment, Rare Diseases we have about 5,500 members between healthcare professionals, support groups, patients, doctors, family members, etc. We have roughly 47,000 people following us on Facebook, so we get tons of questions and queries there. We have, I think, about 5,000 Twitter followers. We're developing quite a following on Instagram. On the LinkedIn space, I have about 4,000 doctors that I am connected with on LinkedIn. So realistically, it is a lot of content to manage. And then we have all the patients and the patient support groups and the WhatsApp groups, etc. So it's really become quite a nightmare in terms of making sure that we are always available. I don't know if anyone's contacted me in the last couple of days. You will see my WhatsApp profile pictures change from I either respond in 0.2 seconds or 5 to 7 working days. And that's legitimately the story of my life, because I'm either online at the time you message me and I can respond immediately, or I see it and totally don't get back to it for a week. So with that, Nicola and I were sitting in the office and we said, you know, what can we do to better empower our support groups to handle a lot of their challenges within their groups better? And really, it is a class mom type scenario. We knew that the best people to ask how to face certain challenges are the people that are living with those certain challenges. And that is you guys. So we want to ensure that the work that we do is informed by people like you. We want to make sure that we always keep patients at the center of everything that we do. And your experience gives personal understanding of what patients need and want within your community. So while we might have a good understanding of rare diseases globally, I can't be an expert on every single condition, and we can never begin to understand what patients battle with that are all battling with a specific thing. So we know that patients are experts in their own conditions. We know that patients have developed lay expertise, which become highly valued in advocacy. And by lay expertise, I mean, nobody knows what the best painkiller is for myasthenics other than myasthenics, because they live with it every single day. And Rare Diseases South Africa needs patients to strengthen our collaborative efforts. We don't want to be out there liaising with government, etc., and the likes of the United Nations, presuming to speak on everyone's behalf without having given everybody the opportunity to filter in to the work that we're doing. So what are we hoping that this group will do is A, help us develop new resources, And it's been really encouraging to see some of the comments coming through on the various little support groups. I know the dysautonomia group today was putting together little resource things, and that's really encouraging to see. 2 is to influence policy development. 3 is to partake in research. 4 is to provide insight to patient medication and device development. And again, this is critical because we often get issued with devices, etc., that are actually, not conducive to what we need them to be doing. So to feed back into those systems is critically important. To strengthen patient involvement, to check the progress of rare diseases projects as they develop and make sure that we are still focusing on what is actually needed in the community, to extend the peer-to-peer support, to share best practices, and obviously to raise awareness across South Africa. So the ultimate goal of the Patient Voices group would be sharing stories, experiences, and opinions by people affected by rare diseases, and helping us shape the work and ensuring that what we do is actually meeting the needs of the patients that we're trying to serve at the end of the day. So again, I'm going to stop for 2 seconds and just check if anybody has any questions. I'm going to switch over to the chat. There is a chat function. If you, let me just pop a message on here. I don't know if you guys would have seen that, but that's how you can send a message if you're wanting to ask a question. So if I look at our stakeholders, we always say we put patients right in the center of what we do, and immediately surrounding them is their caregivers and their family members, and they are there to provide direct comforts and support to patients and see to their immediate needs. Then we have the Patient Voices program, and that's the little circle there in pink, and that is really to provide peer-to-peer support, resources, and vital information to patients, and also to provide feedback to us as Rare Diseases South Africa. Then Rare Diseases is the dark gray circle, and I always say that we take the emotional information from patients and we make it appropriate for external stakeholders to hear, and vice versa. We take the information that we get back from governments, from the Department of Health, from policymakers, from medical aides, and we make it into a softer communication that patients can better relate to. So we think of ourselves as somewhat of a membrane between the inner and outer circle. And then we've obviously got all of our stakeholders, and right on the outside of that, we've got the donors, the rare activists, and the volunteers. And those are the people providing us with the necessary resource to remain focused on our community. So this slide is essentially what we are trying to achieve with the Patient Voices program, and that is to get critical mass. So on the complete right-hand side, we have the patient community, and this is made up of individual patients. And those patients then join into a support group or a WhatsApp group or a Facebook group. When I use the term support groups, it's not a formal group necessarily. Some of them are very informal, and that is 100% fine. So the patients feed into these support groups, and then the hope is that we will have at least 1 or 2 people from every support group on this Patient Voices program. And when patients can then provide their input, which is then collated by the Patient Voices representatives or ambassadors, they then feed it back to us as part of the National Patient Advocacy Group. And then we take all that feedback and we distribute it amongst the stakeholders in the relevant meetings and forums that we are in on a day-to-day basis. And ensure that the patient voice has been understood and appropriately represented. And then from there, all of the stakeholder groups feed into the government policies and review processes. And then if we work the other way back round, what happens is governments and policymakers send out a request for public consultation process that comes to us in our stakeholder capacities. So we sit on numerous working groups and partnerships and alliances, etc. So we get this feedback coming through, asking for information. From there, we take it back to Rare Diseases South Africa as a group and communicate via the patient voices, asking them for community consultation. And the expectation there is that the patient voices representatives will distribute that information back to the support groups and ultimately to the patients so that they can provide feedback and we close the loop. So in terms of peer-to-peer disease-specific support WhatsApp groups, I want to stress something. We've got lots of WhatsApp groups, and we've only created them because, to our knowledge, there wasn't one in existence. If there are other groups, we are not necessarily wanting to create another one specifically. So today it came up that there is 2 groups for Mobius syndrome, and we're happy to refer everybody to that specific group. All that we need is the share link so that we've got the actual referral link to provide them. So it's not about us having our own group. That's not it at all. It's about being able to have a place that we can actually refer a patient if necessary. So if we look here, Rare Diseases South Africa is in the middle, and these are the people that we are focusing, that we communicate with on a daily basis. So it's medical aids in the private sector, it's government, and it's our various stakeholders. And with that, it's also our patient community. So what we're hoping is that by patient voices, the ambassadors for these disease groups, that they will handle the correspondence with regards to disease-specific inquiries. And we will only handle the communication with regards to global issues while we're focusing on the global advocacy stuff. So whether or not we're going to be able to get it to work, we're not sure. We're going to see. It's a pilot program, but I'm hoping that we will. It's also important to notice that when requesting a patient gets added to a group, that we use the join link, because that's important for consenting purposes. If we just go and add a patient to a WhatsApp group, they haven't consented into the process necessarily. But by them clicking on a join link, they've actually consented and they've bought into the process. And we have to take that into consideration because of the fact that we're dealing with patients and their identities. It's very important in terms of POPI. So the role of patient voices, ambassadors. So one is enrolling new patients. So from an enrolling new patients perspective, it's when a new patient is identified, to encourage them. And again, these patients can be identified anywhere. It doesn't necessarily need to only be through rare diseases. If you meet patients in a clinic somewhere, in a doctor's room, etc., people that you know and that you've met along your journey, you can refer them all. Encourage them to please register as a member on the Rare Diseases website. There's no charge for that. And the reason that that's critical is because with our intention of collecting the data that we are looking for to be able to lobby better at government, we need to make sure that we've got the appropriate numbers to do that. And then also to obviously add them to the relevant WhatsApp groups, etc., and to welcome them into the group and make them feel loved and cared for. Some patients will choose not to join a WhatsApp group, and that's totally fine, as long as they can still access information. The second thing would be reporting patient queries and problems. So if in the day-to-day conversation on those groups, you pick up that there's a patient who has now run out of medication or is not able to, has been refused access to a hospital or whatever, to obviously notify us of that problem. Identifying patients that need extra love and support, distribution of information, and collating of information. So I will send all of these out in a slide. In terms of enrolling new patients, I've created a little flow chart to discuss obviously what is necessary with regards to that. So it really is just, is the patient registered? Are they not registered? If they are, where do you send them? If they're having certain issues, where do you send them? So I will send all of this information out in an email as well. Reporting patient queries. So with regards to that, if a patient's having an issue with something, the first thing to do is to always look on the website or the D6 resources to see if there is any information on the topic already. And if there is, obviously send that through to the patient. If there's no existing information, then please send us an email with details of the problem so that we're aware of it. And if it is an urgent thing, please notify us, me specifically via WhatsApp, so that I am aware and I can act appropriately. Anybody who's ever been to our office will know I'm actually terrible on email. With regards to identifying patients that need extra love and support, SADAC, the South African Depression and Anxiety Group, can always be contacted via their helpline. We have had lots of discussions with SADAC about specific nuances, etc., that are specific to rare diseases, so they do have a good understanding about the sorts of care that our patients need and the anxiety that they develop. We also have other support groups, such as Footprints for Sam has a monthly support group and a monthly meeting in Joburg for parents who've either lost a child to chronic illness or are parenting a chronically ill child. We're in touch with many of the palliative care associations. There's the Daniel and Friends Fund, Bereaved, we've got a bereaved support group. We have Swap Shop for special needs items. So if you are looking to sell equipment that you're not using or donate it or give it away, there's a platform for that. And we also have the Rare Disease Patient Support Group on Facebook. So if you find any other groups out there that you feel we could benefit from or they could benefit from us, please do connect us. In terms of distributing information, and this is something that has cropped up a bit, we've had a lot of questions in the group asking, can we share this or can't we share this? So generally speaking, whatever's shared on the WhatsApp group, we've placed there specifically for you to forward onto your relevant groups. If it's on social media, share it if it's appropriate to your group. So sometimes we'll be working on a project that doesn't impact the entire community. So you've got to use your discretion as to what's appropriate and what isn't. And if we've sent it out via email, we will generally request that you share it. Otherwise, it's generally for discussion purposes or for feedback. So the one request is, please, if you wouldn't mind, those of you who are on social media, if you could please pop me a WhatsApp with your social media handles so that we can follow you, but also that we've got them recorded, that if we need to tag you in anything that we can. And if you're sharing anything of ours, please use the Rare Voices hashtag so that we can track it appropriately on social media. So with regards to the collating of information, if rare diseases requires feedback on information, such as with the NHI documents, just so that you guys know, we have been granted an extension that came through yesterday. So we've been granted an extension until the 29th of November. So we've got a little bit more time to work on that. But if we require feedback, this is how we'll do it. We will request that you share the info with the wider community and request their feedback, and that you as ambassadors will gather all that feedback into one document. It doesn't need to be a pretty document, as long as, even if you just copy and paste people's comments and slot it in there, and then return it to us in a Word format so that we can incorporate it into whatever document we're developing. So let me go back to questions. It's so difficult trying to moderate and see people at the same time. Okay, still nothing. Oh, you guys are such an easy crowd. Okay, so with regards to our advocacy process, and this is where we can help you. So our advocacy process is as follows. The first thing is to identify a problem. So we can assist you in identifying issues within your community, or you can notify us of issues in your community. Two, we can help you with the research, understanding the problem, understanding why it exists. Then it's developing a strategy around whatever problem we've identified. It's then acting and implementing that strategy, and then finally it's monitoring. So those are the 5 steps to the advocacy process, and sometimes they go round and round and round for ages, and sometimes you just stay in the monitoring phase for a while. So it just depends on the scope of the problem. What we have available for you as ambassadors to use. So we do have hot desking facilities at our office in Joburg, which provides you with access to a printer, phones, and internet. So if ever there's something that you guys are working on that you need access to resources, you are more than welcome to come and work at our offices. That's why we have them. We do have a boardroom if you're needing to have meetings of any kind. So if you're wanting to connect with, if you're wanting to have a support group meeting, as an example, you're more than welcome to contact us to use the boardroom. We do have graphic design support, so with developing materials, etc. We have various suppliers that provide us with relatively good rates. We do have mentoring support. We've got a give and gain fundraising platform. So if as a collective group, as an example, the dysautonomia group today, they are wanting to create badges. If you're wanting to fundraise specifically to get the badges covered, we can make use of the Give and Gain platform. We just can't use it to benefit one patient. It has to be to benefit a group or a disease entity. Then we have access to capacity building. So some of you might have come to one of the patient huddles, etc. We have the use of webinar online meeting platforms such as this one. So if as a group you guys are wanting to have an online meeting, you can let us know, we'll set it up for you, and then you just have to log on. And we do provide you with social media support as well. And then finally, with regards to fundraising and communications, so this is it's a new thing that we've just developed. As you can see, we're going through a bit of a brand change. It's taken us a while to get our website, so it is coming, and it will all be in the new brand. But this is where our funds essentially are used. So there's obviously lots of different things that we're busy with at any given time. And how can we receive funds? Zapper, we've got a Zapper code which we can send through to you, and you can print it and use it anywhere. We've got SnapScan. SnapScan does issue little, they almost look like little credit cards with the code on them. If anybody wants one, we can have one printed for you. We've got Give and Gain. We've obviously got EFT. There is the monthly debit order. There's a credit card machine. We've got the My School program. And we do have a fundraising and events toolkit, which I will send out to you. So if anyone is wanting to do any fundraising and they're wanting to use rare diseases to do that, those are the options that are available. And then lastly, we've developed a little bit of a message track. So if anyone's doing any PR and media, specifically these are the key messages that we use from a rare diseases South Africa perspective. We are available to assist you in developing your message tracks for your specific disease too, if you are wanting to create them. And then in terms of joining our community, these are the various community options that we have on our website at the moment. So it's for patients, caregivers, families, healthcare professionals, support groups, and rare activists, and those are the various links. Obviously, there's our social media handles, and then finally, our contact emails for all of us at the office. So those are the portfolios that we all handle. And if anybody has any queries, they're more than welcome to contact us. So now I'm going to open it up to you guys to ask any questions. And I'm going to just go through everybody one at a time, if that's okay. So the first person is Megs. Megan, do you have any questions?
No, I really want to thank you for all the hard work that you put into this. I don't think a lot of people realize all the stuff that Rare does behind the scenes. So yeah, thank you so much.
Thanks, Megs. Okay, Candice Mess, you're up next. Candice, I'm going to unmute you now.
Hi, everyone. Yes, I'm here. Sorry, I don't know if my camera's working.
No, it's not. They're all off.
Okay. Just no questions, but I'm really excited to be part of the organization and to get our voices out there.
Thanks very much. It's good to have you. We have another Candice. I'm not sure if it's the same one, maybe linked on twice. There's a second Candice.
It's another Candice. I'm actually the class mom with Megan. And yeah, just excited for the process forward and definitely have a couple ideas. So we'll chat.
Great. We're looking forward to hearing them. Okay. Chelisani, are you there?
Yes, I'm here.
Are there any questions from your side?
No, not at the moment.
Great, thank you. Okay, Diane.
Hi, Kelly. No, I just wanted to second what Megan said and to say thank you for the initiative. And I'm really quite excited about this. And I'm hoping to see Cape Town more involved. Our Rare Disease Days in Cape Town have had a fairly poor turnout over the last few that I've been to. And I'd really like to see us doing more from this side. Mm. Yeah. But no questions at this point.
Yeah, absolutely. Perfect. Thanks, Diane. No, but I do agree. I think our community, obviously because our offices are based in Collating, I think they've had a lot more support than what we've been able to give to the outlying regions. And I really would like to see, more things coming through from their side, from those sort of areas, because obviously, there's patients across the country and we want to make sure that they're all feeling equally as supported. Okay. Helen?
Hi, can you hear me?
Yes.
Is that you, Jenny? No, Helen Smith, Helena Smith. Is that the one? You're talking to me, Kelly?
Oh, no, I'm speaking to Helen. Sorry, Helena, I'm speaking to Helen Malherber.
Okay, cool.
Hi, this is Helen. Yeah, I think there's a lot to digest, but I think it's going to be great to see a lot more people involved. Why didn't you think of it before? I'm just joking. No, I think it's a really good move, and it just makes so much sense when you look at it logically, and I think it's going to be really exciting to have a lot more people involved. So well done.
Absolutely, thank you. Okay, Helena, your turn.
Okay, thank you for the opportunity. It's really fantastic what's happening in terms of advocacy and the program. We're very, very glad to know that we are included in this so that there's a bigger platform for us to work from. And Helga is also on the call tonight. We're from multiple sclerosis, and we are really looking forward to working together and finding solutions for the patient problem.
Absolutely, thanks. It's good to have the groups such as multiple sclerosis. I mean, you guys are a relatively large group, so it's nice to know that we're all working towards a common goal. I think it's really important.
Yeah. Thank you for the opportunity.
Thanks, Helena. Helga, anything from your side?
No, nothing more from my side. Just pretty much what Non or Helena Smith has said about multiple sclerosis, and it's nice to be able to integrate hopefully into your platform and use the backing and the links that you have.
Perfect, thanks. Okay, Janet.
Good. Thanks, Kelly. It was a great presentation. Thanks for all the hard work. Very impressive presentation. We're also looking forward, and I just want to say thanks already. I know the immune deficiency community has already used a number of your patient support mechanisms, and it's worked really well. We did one of our patient support groups via the Zoom, which everybody really enjoyed, and it made it a lot easier, and also, just made the whole exercise a lot more worthwhile because we got a much bigger reach. So it was really good, and we're looking forward to working more with rare diseases. Thanks.
Thanks so much, Janet. Yeah, I think this platform is really, really, it's relatively easy to use. It can be used on any phone device, any smart device with a stable internet connection. And I think as a result of that, it makes it a really, really good platform for people who are otherwise not necessarily able to be out and about and come to, teas and breakfasts, etc. So it gives everybody an opportunity to still have some form of interaction and contact. And the PINSA group, they actually had a doctor, and they had a doctor's presentation, and anyone around the country was able to actually, ask this doctor questions and get involved in the content. So I think it was really worthwhile. Next up is Karen from Prader-Willi.
Hi there, can you hear me now?
Yeah, perfect.
Okay. Oh, great. No, thanks. The presentation was great, and it totally makes sense to try and limit the number of contact people. I think that we were sort of hoping to do that anyway from the outset. The other thing I just wondered was, I haven't explored the D6 that much, and I was just wondering, I don't know if you have it on your laptop, if you could just show us around it, or if anybody else is interested, a little tour of the D6. But if everybody else knows their way around it, then don't worry, I'll give it a bit of time.
Of the D6.
Yeah.
Okay, so what I'll do is I will actually do a video tutorial, and then I'll load that up. I'll send that out so that you guys have got it and you can forward it to patients and stuff. It is a little it's a little old school from a back end perspective, but I think it's really functional from a front end perspective. It's a really good communication tool. I think it's important to note that it is two-way communication. So patients can send us messages on that platform and we can communicate directly with one-on-one individuals, which is good from a confidentiality perspective. But also we can add you guys as moderators, and you guys can start adding your own resources and stuff on there when everybody gets a bit more comfortable with it. So I didn't want to overwhelm you all at the same time. You know, from the outset, but there is that opportunity available. So we will start setting that up for anyone who wants it. And then really the world is your oyster in terms of what you do with it. So good stuff. Thanks, Karen.
Okay, great. Yeah.
Okay, Lilani, you're up next.
Hi. Thank you very much for this meeting, and thank you for the presentation. I just want to know that when we reach out to the community, and so on, say for example, like ISTAG's emergency contact information thing, they are basically looking for proof that we are ambassadors, because there are so many scams going on. Yeah. So it's very hard for these people to just believe anyone that's saying, hey, I'm an ambassador and please help us.
Yeah, it's actually a very good point. So the first thing the reason we asked for everyone's portfolios to be sent through, your little blurbs, etc., and your photos, because we are loading those onto the new website, so there will be validity from that perspective. And then we can also look at creating a document for each individual person to state exactly what they're using, you know, what they're doing, and what disease area they're involved in, and what the program's about, to actually provide that validity. So thanks for bringing that up. We will absolutely work on that. Was there anything else from your side?
No, not at this stage.
Okay, perfect. Thanks very much, Melanie.
Thank you.
Okay, now we're going to Leilani Johnston.
Hi, Kelly. I'm just trying to juggle kids here as well. I hope there's no noise coming through.
No.
Otherwise, yes, very good presentation. Thank you very much. I think it was Diane that brought something up a bit earlier in terms of Rare Disease Day being a little bit quieter, possibly in Cape Town this year. I think you might feel the same as me. It was a little bit quieter in Gauteng as well. So I don't know if we can maybe help with more exposure and things like that for February 29th next year. So generally speaking, because I also get around to quite a few hospitals, I have tried to create as much awareness for the organization as possible as well, just for even doctors to reach out, to put doctors in contact with other doctors that might have picked a 1 in 100,000 child up. So just an idea. I'm just saying, just to possibly have the hospitals involved next year as well, to have their own rare disease days. It's just an idea.
Yeah, absolutely.
Yeah, then otherwise from my side also, I've been a little bit useless with the D6, so I'll catch up with Megan as well to help me out with that. And so I just found out yesterday that we have a WhatsApp group. So I don't know if I need to send you the link for that, because I only knew about the Facebook one.
Yes, please do. Anybody who's we've started up WhatsApp groups where we didn't know of, and you know, where we had a group of patients that were trying to connect, and we didn't know that one existed. But if there is one in existence, we don't want to duplicate and we don't want to reinvent the wheel. So please send those share links on.
It seems that it's not just me who found it. So there were only about 5 people, but now since we mentioned it on Facebook, it seems to be quite a bigger group. So I'll send you that. I'll try and find out how to send you the link for that as well. So
perfect.
Otherwise, good job. Keep doing what you do. Thank you.
Shame. Thanks, Ilani. Okay, Mareka.
Hi, Kelly. I know we've been talking quite a few times now. So from my side as well, thank you very much. And then on the WhatsApp groups, topic, I've seen the intracranial hypertension group. There is 2. I've already asked because the group that you guys started has only got 21 participants. So in the meantime, I've asked Alette to add you on the other WhatsApp group so that we can have that combined as well. So Alette will send you a link, and I think she said she will make you admin as well so that you can help her to add more patients and everything on the group.
Okay, perfect, yes. Where there is a group, we must most definitely use it. It's much easier.
No, definitely. And then Melanie, the other IIH lady, we had some coffee on Tuesday already. So we've got a few things that we want to discuss with you. Then donation letters. We need to try and help. You need to try and help us to get a letter on a letterhead where we can ask people for support, especially if we need funds for events and things like that.
Yeah, absolutely. We'll work on that.
Okay.
We will sort that out. Perfect. Thank you very much.
But thanks again.
Thank you. And then last but not least, it looks like it's Veronica. Veronica, are you there? It seems as though Veronica's line is not working. Okay, so thanks everyone. I'm just flicking through the list again. I think I have got everyone. If someone hasn't had a turn, please just raise your hand. What I also wanted to say, so upcoming events like Leilani mentioned, obviously Rare Disease Day. So every 4 years we try, the leap years, we really try make a big deal of it. So Rare Disease Day is coming up next year. So we are starting to think about ideas, etc., for Rare Disease Day, and we'll put together a toolkit, etc., like we did, like we've done in the past. But please, if you've got ideas, if you want to approach schools, etc., by all means, go out there and go forth and multiply. We would really appreciate it. Rare Disease Day is single-handedly the most challenging event for us because there's such interest from numerous schools and corporates, but we physically cannot be in more than one place at a time. So as it is, we've already sort of booked out all the corporate slots that we have in Joburg for next year in the month of February. So it's really difficult. So we need all the hands that we can get on deck there. And secondly, the 947 cycle challenge is coming up. So there's sort of 3 main rare activist events in a year. One for cycling is the 947. We used to do the Cape Town cycle tour until we got blown away one year and people got injured and we haven't been back. We've been too scared. But we do the 947 every year, and entries are closing on Monday for the 947. So if you know of anyone who's wanting to cycle for a purpose, please send them our direction. Then we do the Two Oceans Marathon, which is generally in March every year. We get pre-assigned entries for Two Oceans, both the Ultra and the 42K. No, the 42K and the 21. And then from a swimming perspective, we do the Midmar and the Sun City Dischem swim. So we've got running, cycling, and swimming events that take place throughout the year. And the swimming event is also coming up in October. So if anyone knows anybody who's good in the water and might want to swim for us, please let us know. Unfortunately, I'm not great in water, so it won't be me. But if anyone else wants to jump in, I'd be more than grateful. I see Chilasani has raised her hand, so I'm just going to unmute her for 1 sec to ask whatever she needs to.
Hi, Kelly.
Yes.
You can hear me?
Yes, perfectly.
All right. Okay. I'm an ambassador for VACTEL Association.
Yes.
So there's something that is a bit worrying because, like, when you share information on the main Rare Voices group, and then I send that information to the VACTEL group, it doesn't seem to be active. I don't know how I can put it, but I hardly ever get responses, and there's quite a few people there, like less than 10, and I believe the VACTEL Association could have more people than that. Can we maybe try and publicize it on the Facebook group or something like that?
Yes, absolutely. And if you've got the details of the VACTEL an other VACTL group, please put them in touch with us, because it's a prime example for, once again, for us to collaborate, for us to be able to refer patients and let them get supported by the experts in those conditions, so we can carry on focusing on the advocacy stuff. So absolutely. There are some of the WhatsApp groups. Some patients obviously choose to share more than others. But there are some groups that are really active, and then there's some groups that are really inactive. So I also think it's just about, really trying to make people feel welcome. And I suppose for a lot of people, it's a bit overwhelming sharing such personal information, and it's like bearing your soul, to people that you haven't necessarily met. So to try make everybody feel loved and supported, so that we can create this community that they feel safe enough to be able to share and start opening up and communicating better.
Yeah. Okay. All right.
Okay. Thanks, Jelisani.
Okay. Thanks, Kevin.
Okay, Shane. So thanks everyone. I see we've had a latecomer, Marilee. Very excited. Marilee is our new sort of fundraising person, and she has agreed to assist rare diseases in developing a fundraising strategy, a long-term fundraising strategy. So we're very excited to have Marilee on board. And she's also a bit of a superstar in her own right. I'm going to actually unmute her for 2 seconds so she can tell us a little bit, introduce herself to you all. I hope she doesn't mind just me doing this. I'm putting her on the spot. Are you there?
Hi, Kelly. Yeah.
Oh, wait. I've unmuted her. Wait. Why is it not working? Oh, Marilee, sorry, I can't unmute you for some reason. Oh, there, we can hear you now.
Hi. Okay, I've unmuted myself. Thank you.
Sorry.
Can you hear me? Can you hear me
yes.
properly now?
Perfectly.
Okay, excellent.
Oh, and we've lost her again. Oh no, I'm not sure what's happening. But anyway, as soon as so we're having a sort of in-depth workshop this coming week with Marilee, and as soon as we've done that, I'm looking really forward to being able to share all that information with everybody. And I'm sure she's already done a fundraising audit and has come up with some really interesting concepts and findings that I'm sure will strengthen this community quite a bit. So I'm looking forward to being able to work with her. Okay. Oh, right. We've just had Karen joining. Hi, Karen. How are you? Oh, shame. Can you hear us? No. She's also got no. She's on. I can't unmute her for some reason. So yeah. So thanks, everyone. I appreciate everyone joining. I really hope that we can take this from strength to strength. I know the idea would be to obviously try have these sorts of calls on a relatively regular basis, but we'll just do it as we go along. We will make ourselves available to assist in any way that we can. And if you have any urgent burning questions, you can always pop me a WhatsApp. Alternatively, Nicola, who is our program manager at the office, is super OCD and the most admin orientated person I know. And I'm friends with Helen and Megan, so that must tell you something. So if you need anything from a administrative perspective, Nicola's definitely your person. If it's advocacy related, then it's probably easier to come to me, or alternatively communicate with one another. A lot of us have been through the same issues and we've all done the same things. So there's a lot of knowledge amongst all of us, and I'm sure we can actually do quite a lot of stuff. So looking really forward to it. Thanks so much, everyone. Thanks for joining, and hope to take it from strength to strength. Okay, just checking. I just want to check the chat. There is some stuff that's come through here. Sorry. I haven't explored the D6 much. Okay, Karen, D will be fantastic. So I'm not sure what's going on. Okay, perfect. Diane, perfect. If I receive permission to share info, what would be the best platform? Diane, to answer your question, what would be the best platform to share information? It depends on what it is. I think if it's a resource, if it's something like a reference material or something like that, probably on the G6. But if we're needing quick information on something, or wanting to share like an upcoming event, like a awareness day or whatever, then probably WhatsApp, because I think a lot more people are on WhatsApp more continuously. But if it's something that we obviously want patients to refer to at a later stage, I think the D6 is probably the better option. So I think that is everyone. Okay, guys, I hope you all have a great evening. No, 2 more messages have come. Oh, it's just saying thank you. All right, so I hope you guys all have a great evening, and we look forward to collaborating soon. Thanks so much, Cheerio, bye.